Welcome back to this series on shoulder pain. Today, we're looking at when you might consider surgery for a rotator cuff problem. Drop a comment down below if you're considering surgery and what you've been told about your options.
All right, let's just jump right in with a number that might kind of blow your mind. 4.5 million. That's how many times people just in the US go to the doctor for shoulder pain every single year. It is one of the most common issues people face, and you guessed it, a huge chunk of those visits are all about the rotator cuff. And all those visits lead to this one huge question that so many people are wrestling with. Do I actually need to have surgery? And honestly, it can be super confusing and stressful. It feels like you get 10 different opinions from 10 different people, right? So today, we're going to try to cut through all that noise. We're going to walk through the actual evidence, step by step, to help make sense of it all.
Okay, first things first. Let's make sure we're all on the same page about what we're actually dealing with here. Because, it's often a lot more complicated than just seeing the word tear on an MRI report.
So a term you're probably going to hear more and more from doctors and physios is rotator cuff-related shoulder pain, or RCRSP for short. And this is a really big deal because it represents a total shift in thinking. The old idea was, oh, something's getting pinched in there. But now we understand it as an issue of load tolerance, which is really just a way of saying, hey, the tissues in your shoulder are just getting overwhelmed by the demands being placed on them.
So, if the problem is that the shoulder can't handle its load, what's the first thing you do? Well, it turns out there's an incredibly strong agreement across pretty much all clinical guidelines on where you should start.
And here it is. Before anyone even starts talking about injections or surgery, the evidence is it's overwhelming. The absolute first step should be a focused program of exercise and education. And this isn't just, a casual suggestion. It is the #1 top-of-the-list recommendation from experts all around the globe.
And the best part is, this approach really works. Study after study shows that if you commit to a well-designed rehab program for about 3 to 6 months, the benefits can be incredible. We're talking significant pain reduction, getting your arm moving freely again, building back your strength, and just, having a better quality of life. The key thing to get here is that this isn't just something to do while you wait for an operation. It is a powerful treatment all by itself.
Okay, but what if you've done the rehab and you're still not where you want to be? Or you've got that MRI showing a confirmed tear? Well, this is where we hit the first major fork in the road, and the type of tear you have is absolutely critical.
So think of it like this. There are two main paths. On one side, you've got degenerative tears. These are the wear and tear kind that happen slowly over a long time. These are by far the most common. Then on the other side, you have traumatic tears. Bam! They happen from a single, sudden event, like a fall. Now that traumatic tear is what doctors often call a red flag, and it might fast-track the conversation about surgery. Figuring out which category you fall into is one of the most important steps in this whole process.
So, for those common degenerative wear and tear type problems, the evidence for sticking with that non-surgical path is surprisingly strong, even when we look way down the road.
Let's just look at this number for a second. There was a landmark study that followed patients who had these chronic, full-thickness tears, and what they found was staggering. A full 75%, that's 3 out of every 4 people, were able to successfully manage their shoulder without ever needing an operation.
And we're not talking about a temporary fix either. That success was still there at the 5-year mark and even beyond 11 years. Their quality of life scores were basically identical to the group that did have surgery. And get this, between year 5 and year 11, only 2 people decided they needed to cross over and get the surgery. That tells you that for most people, non-operative care is not just kicking the can down the road.
Now, this next idea is probably one of the most powerful findings from all of this research. It's a direct quote, and it tackles that big, scary fear so many of us have. Oh no, what if my MRI shows the tear is getting bigger?
What this really means is that we have to be so careful to treat the person, not the picture on the scan. In that same long-term study, nearly half of the people who were doing great without surgery actually showed that their tear had gotten a bit bigger on an MRI. And yet, they felt fine. Their quality of life was high. The crucial point is, what you see on that scan, it just doesn't tell the whole story. Not even close.
Okay, so with all of this compelling evidence for non-surgical care, when does surgery actually become the main recommendation? When do we start to really talk about it?
Well, the guidelines are pretty consistent on this. There are really 2 main triggers for a surgical referral. The first one is what we've already talked about, a clear, sudden traumatic tear. The second trigger is when someone with a degenerative tear has given a dedicated, structured rehab program a real, honest shot for at least 12 weeks, and they're still not able to do the things they want and need to do in their life.
Now let's look at some long-term data from the other side. A major study followed patients for 15 years. And if you just look at the numbers on the page, it seems pretty clear. The group that had surgery right away scored statistically better on things like function and pain compared to the group that only did physiotherapy.
But this brings up a really, really important question. Okay, the numbers are statistically superior, but what does that actually feel like in a person's day-to-day life? Is it a difference you'd even notice?
And this is where it all gets a little more nuanced. The researchers themselves pointed out that even though the results were statistically significant, the actual difference between the groups was tiny. It was often below what we call the minimal clinically important difference, which is just a fancy way of saying it's a difference so small the average person might not even notice it. You know, it's like your phone battery lasting until 9 p.m. versus 9:05 p.m. Sure, one is technically better, but does it really change your night? Probably not.
Okay, so let's put all of this together. How can you take this information and use it to make a smart, informed decision that is right for you?
So let's recap the 4 biggest takeaways. 1. Rehabilitation is almost always where you start. 2. Knowing if your tear is from gradual wear or a sudden injury is a huge deal. 3. That MRI report is just one piece of the puzzle, not the final answer. And 4, for most people with those chronic degenerative tears, long-term success without surgery isn't just possible, it's actually likely.
So you can almost think of this as a simple guide. The start with rehab path is for you if your tear is degenerative, if your symptoms have been around for a while, and if you haven't really tried a proper exercise program yet. You start to discuss surgery if you had a clear traumatic injury, or if you've put in 12 solid weeks of rehab and you're just not reaching your goals.
So, at the end of the day, we haven't given you the answer. The goal here was to prepare you to find your answer. The whole point is to empower you to walk into your doctor's office ready to have a real, informed conversation about your specific situation, your goals, and your options. So this whole explanator really leads to a final question. Not for me, but for you to ask. Now, what are the right questions for your doctor?